Most people don't realize it, but how you sleep tonight could quietly raise your risk of stroke. One common sleeping posture can put harmful pressure on your circulation, especially as you get older. In the next few minutes, I'll explain which position doctors warn about and show you how to fix it before it becomes dangerous. If you sleep on your right side, stop for a second. I'm serious. That comfortable position might be restricting blood flow to your heart every night. As a cardiac surgeon, this terrifies me. About 30% of strokes occur between midnight and 6 a.m., while people are asleep. I'm Drive, William, and over the next 15 minutes I'll rank 5 sleep positions from bad to most dangerous, and give you 2 safer positions that can protect your brain tonight. Before we begin, tell me, back sleeper, side sleeper, or stomach sleeper? In the next minute I'll tell you if your habit is on this list. If you're over 60, what I'm about to share is especially important. Number 5. Sleeping completely flat on your back with no elevation. It feels natural. Your spine is straight and many people prefer it. But when you lie perfectly horizontal, especially after age 60, blood pools toward your head. Young blood vessels are flexible and tolerate this, but as arteries stiffen with age, the tiny vessels in the brain become fragile. Hours of increased head blood volume can raise pressure inside your skull. That pounding headache at 3 a.m. may not be random. It can reflect elevated intracranial pressure. Research in the Journal of Clinical Sleep Medicine found that elevating the head by about 15 degrees reduces that pressure and helps blood return to the heart. A common warning sign is lightheadedness when sitting up quickly in the morning. That isn't just getting older, it's a sign your overnight circulation may be off. I'll give the exact correction at the end. Number 4. Sleeping on your right side, particularly if you have heart disease or high blood pressure. The heart sits slightly left of center. When you lie on your right side, body weight can press on the inferior vena cava, the large vein that returns blood from your lower body. Even mild compression forces the heart to work harder to refill. For a healthy 30-year-old this might be manageable, but for someone over 60 with borderline heart function or hypertension it adds nightly strain. Clinicians notice patients with heart failure often avoid the right side because it feels uncomfortable. A study in the European Journal of Heart Failure linked left side sleeping with more stable overnight circulation and less cardiac stress. Decades of nightly extra workload may not show up on daytime readings, but they can contribute to a stroke at 4 a.m. If you sleep on your right side, consider switching. Number 3. Stacking multiple pillows under your head. People do this for breathing, reflux, or sinus drainage, and some elevation helps, but too much creates a forward neck bend. Running alongside the cervical spine are the vertebral arteries, which supply the brainstem and cerebellum. Excessive neck flexion can reduce flow through these vessels. You might wake with neck stiffness or a dull base of skull ache, not only muscle pain, but possible reduced blood flow. Research shows extreme forward neck bending decreases vertebral artery flow. Over 8 hours every night, that adds up. Many patients switch to a single contoured pillow and see symptoms improve quickly. Number 2. Sleeping tightly curled in a fetal position. It feels safe and common, especially in older adults, but it causes two problems. First, a curled torso limits lung expansion. With the chest compressed and the chin tucked, breathing becomes shallower all night. Even a 10–15% drop in oxygen saturation stresses the heart and brain, especially in people with cardiac or lung disease. Second, persistent neck and upper back tension can compress small vessels near the base of the skull, further reducing cerebral blood flow. Studies in respiratory physiology show that significant spinal flexion reduces tidal volume over time. If you wake feeling foggy, short of breath, or with a headache, this posture may be to blame. The fix is straightforward and I'll describe it shortly. Number 1. Going to bed within 2 hours of a large meal or after drinking alcohol. Evening meals and drinks are common, but this combination is the riskiest. After a big meal, blood is redirected to digestion, leaving less available for the brain and heart. Younger bodies compensate. Older people with narrowed arteries may experience dizziness or fainting during sleep. Alcohol dilates vessels and disrupts normal overnight blood pressure patterns. For seniors with atherosclerosis, these swings can stress vessel walls, promote clotting, or even precipitate rupture. The American Journal of Hypertension has shown that alcohol close to bedtime disturbs the normal nocturnal blood pressure dip, increasing cardiovascular strain. Practical advice. Finish dinner at least 3 hours before bed, stop alcohol 4 to 5 hours before sleep, and take a 15-minute walk after eating. Even these simple steps can reduce overnight stroke risk substantially. Now, the safer positions you should try. First, sleep on your left side. Gravity helps heart function and improves circulation when you lie on your left. Importantly, research on the brain's glymphatic system, which clears metabolic waste during sleep, shows side sleeping, especially on the left, may optimize clearance of proteins linked to Alzheimer's disease. Left side sleeping also helps reduce acid reflux. Use a body pillow to support your torso and a small pillow between the knees for spinal alignment. You will likely roll at night. The goal is to spend more time in the beneficial position. Second, back sleeping with a gentle incline. Elevate the upper body 15 degrees to 30 degrees. A wedge pillow or adjustable bed that raises the whole upper torso, not just the head, helps venous return, lowers intracranial pressure, and improves breathing. This benefits people with poor circulation, swollen legs, or mild sleep disordered breathing. Place a small pillow under your knees to preserve spinal curvature. Note: severe sleep apnea may worsen on the back, so side sleeping may be better for those individuals. Bedroom habits matter too. Keep the room cool, about 64 to 68 degrees Fahrenheit, to lower nighttime blood pressure and promote deep sleep. Avoid blue light after 9 p.m. Screens suppress melatonin and delay restorative sleep stages. Use a single contoured pillow for proper neck support. Reduce disruptive noises with a white noise machine or earplugs to prevent micro-arousals that stress the cardiovascular system. Track signals from your body. An overnight pulse oximeter can flag repeated oxygen drops below 92%. A smartwatch or sleep ring can monitor heart rate variability. Low overnight HRV signals poor recovery, and a simple sleep journal noting morning headaches, dizziness, or fogginess can reveal patterns. These tools are for awareness, not a substitute for medical care. If you notice worrying trends, see your doctor. Why don't people hear this? Sleep position isn't usually part of a short clinical visit, and there's no simple lab test for it. Still, growing evidence links sleep posture to blood flow, oxygen delivery, intracranial pressure, and clearance of brain waste, all processes that matter for stroke and long-term brain health. For people over 60 or with cardiovascular risk factors, adjusting nightly habits can be powerful. Pick one change. Today, try left side sleeping. Elevate your upper body 15 degrees, finish dinner earlier, or switch to one contoured pillow. Give it 7 days and notice morning symptoms. Less headache, better energy, clearer thinking. Share what you change. Your experience could help others. Which adjustment will you try first? Would you like this rewritten in a shorter version suitable for a social media caption or kept as a full-length script?